I think one of the important questions that Harmony can actually work on is quality of life of patients. It's of course not only about clinical outcomes, but how people live with the symptoms and effects of treatment and disease. And I think big data can help a lot to actually consolidate a lot of data about different therapies, about different factors that influence quality of life, and actually find, let's say, interventions that might improve quality of life in the end and really improve patients' lives with hematological malignancies. I think, of course, one of the main obstacles on data sharing are the legal agreements, because when lawyers talk, I mean, you get huge amounts of contracts and pages, and it takes ages on pharmaceutical industry and academic centers and so on to get these rules clarified. But that's often just, let's say, the surface. The issue is that very often there's an unwillingness to share data, because, of course, it requires work to get the data extracted, to work it up in a way that Harmony can digest that. But very often also there's an unwillingness because industry may not like, for example, head-to-head comparison between different products, or doesn't want to, or wants to have full control on what the findings will be. And that's why there's often also an unwillingness actually to share data with a project like Harmony, or let's call it reluctance. And that's what we need to overcome, because it was said today at the sessions. It is so important. We cannot learn, we cannot proceed, we cannot advance in research if everybody sitting on their data is not sharing it for example, big data research and artificial intelligence. We need to be fast in learning, and patients have given their lives to that data. So it's really reasonable to share the data and use it for research. I think it's very important because big data can actually help to, for example, identify prognostic factors. We have, for example, seen here in the data that was presented about AML, acute leukemia, that we could see that the current way we predict risk and potential progression is probably not meeting reality. You can read a lot out of specific gene mutations by looking at huge data sets and then looking at different stratifications of the patient groups and look at subgroups. I think that's tremendously helpful. But of course, not only that, it will help to avoid overtreatment, avoid undertreatment, and optimize quality of life of those patients that need to live with hematological malignancies. And I think that's a key concern of the patient community too. So in summary, overtreatment, undertreatment, the wrong treatment, ineffective treatment, prognostic factors, and also improving quality of life are important outcomes of this project. I think it's a unique opportunity to get all the players involved in hematological research and patient organizations to work together. Because it's so difficult for competing companies to work together, it's very difficult for academic institutes to work with all stakeholders. Very often we work in silos, and IMI or IHI projects like Harmony can actually help to get all the stakeholders together. And from a patient community perspective, of course, it's a perfect opportunity for us. We're working with the key opinion leaders from the different hematological diseases, and also work with the different companies on a common goal to use big data and establish a platform for analytics of huge amounts of data to really learn in a much quicker way about good outcomes, about meaningful outcomes for patients. I really hope in the future of Harmony will be funded, because at the moment we have a project that is funded for 5 years. And if we don't find transition funding afterwards to maintain the platform that we've built, to continue with the partnerships that have developed over the years, it would be a disaster to end at that time. So my wish for the future of Harmony is that everyone involved in Harmony, plus of course the European Commission, will think about how can they sustain such a project, how can they fund the important things, and what are the incentives of all the different stakeholders to contribute data and to benefit from it. That's my wish for the future, that we'll find a solution for that, that Harmony will continue, because it's tremendously important.